In today's video, we will talk about the CO2 laser procedure. The CO2 laser is a safe outpatient procedure which helps to improve acne scars, stretch marks, and is used for facial rejuvenation. Prior to the procedure, it is important to avoid prolonged sun exposure, tanning, in the area to be treated. If it's on the face, men must attend the session well clean-shaved. If you have an infection or very active acne on the day of the laser, the procedure cannot be performed. During the procedure, it is performed under topical anesthetic cream and you may feel a slight pain and heat in the treated area. After the procedure, the treated area will be red, swollen and tender. The swelling and tenderness usually last for 1 to 4 days. Scabs will form in the shape of several dots in the treated area, which can last for the first 3 days. After the scabs fall off, the skin remains slightly red for 5 to 10 more days. Normal redness can last for weeks, and since the treated area will become very sensitive, proper care is essential for the best possible result. It is important to mention that the results of the CO2 laser procedure will be visible after 3 to 4 months. The first 3 days, it is important to keep the skin as moist as possible at all times to ensure proper healing. Skin should be covered with a generous layer of emollient ointment every 1 to 2 hours during this healing phase. The cream can be applied directly with the hands, but the hands must be washed first. There is no need to remove the ointment before the next scalp pack. The scabs or red dots will form throughout the treated area. Any scab formation that appears must not be disturbed, scratched, or removed as they will fall off on their own. Cold compresses should be applied, which can be cold water and vinegar. Do not apply the first 3 days soap on the treated area, makeup, scented creams, perfumes, and sunscreen. At bedtime, apply emollient ointment after your last compress. Make sure the entire treated area is covered with ointment. Place an old towel on the pillow to prevent the ointment from damaging the pillowcase. To protect the face and reduce inflammation, it is best to sleep on your back with your head slightly elevated. Some people place 2 small towels on either side of their face to keep them from turning over during the first night. Immediately after waking up the morning of the next day, you should apply the cold compresses for at least 15 minutes. This will help loosen any scabs that may have formed overnight. Afterwards, you can shower applying warm or cold water on the face, but do not let the water hit it directly. Do not use any soap on the face. After leaving the water on your face, you can shower and wash the rest of the body with warm or cold water. The stream of water and steam help loosen any scab formation. You can wash your hair with mild shampoo, such as baby shampoo, or avoid shampooing the first day after the procedure. After showering, perform a second cold pack for 15 minutes. Then take a 4x4 wet gauze pad and carefully wipe off any loose scabs. Do not scratch or remove any scabs with your nails. After each cold pack, pat skin dry with a soft towel without scrubbing and then apply the emollient ointment generously. It is essential to keep the skin in the treated area covered with emollient ointment at all times, because the skin heals best in a humid environment. When the scabs fall or when the redness goes down, you can start applying dermatological sunscreen every day in the morning and noon. It can also be switched to a light moisturizer like hyaluronic acid or vitamin C serum. The first 2 weeks, moisturizer and sunscreen should be applied at least 3 to 4 times a day. At this point, the skin is still very sensitive and may not tolerate certain skincare products. The skin is still recovering, and you may notice the following side effects. A pink or red skin is normal and reflects the healing process. It can take a couple of weeks or months for it to fully heal. The skin may itch, scratch, or feel tight. Itching can occur during the first 3 weeks after the treatment. Most people feel relief with the use of cold compresses. If the itching persists, in some cases, Dr. Vanessa Giraldo can formulate an anti-itch cream. Due to the application of the ointment, the pores can become clogged. People can develop small temporary outbreaks of pimples or small superficial acne pimples. But they should not suspend the application of the ointment but contact the dermatologist if it is a very strong outbreak. Some patients may develop lighter or darkened skin in the treated area. depending on how your skin heals, certain medications may be prescribed to help minimize redness or darkening of the skin. You can start wearing makeup 1 or 2 weeks after the CO2 laser procedure. It is important to remove very light makeup every night with a mild cleansing lotion, and please avoid rubbing the skin too hard. Although the above regimen is repetitive and time-consuming, the first week is important for a great result, so don't forget to keep your scheduled follow-up appointments. If you experience any pain, discomfort, or stinging in the first 3 days, you can take Tylenol every 6 or 8 hours depending on the pain. But if pain persists, it is better to ask your dermatologist if a stronger medicine needs to be prescribed. The pain should gradually improve within a few days after the procedure. If pain persists, please contact us. Swelling and redness are expected to be significant during the first 24 to 48 hours, especially around the eyes. It is very important to keep your head upright or elevated with 2 or 3 pillows when resting. We also recommend avoiding bending over or lifting a lot of weight during the first week. If there are unusual symptoms or signs that suggest infections such as fever, increased swelling, blisters, or redness in the area, please contact Dr. Vanessa Giraldo, who will tell you what to do. It is really important to avoid all contact with anyone who has a cold sore or skin infections. If you frequently present cold sores or blisters on the lips after the laser, it is important to inform because you may need a cyclovir taken for a few days. During this healing process, it is also very important to avoid direct contact in the laser-treated area with any pet or animal because their saliva and hair can cause irritation or skin infections. Avoid swimming, sauna, hot tubs, and exercise for at least a week or 2 until the skin has completely healed. Avoid direct sun exposure for 3 months after the laser procedure. During the immediate post-operative period, the first week, it is recommended to stay indoors during the day. Afterwards, you should use sunscreen every day, staying indoors mainly during the hours with the strongest sun, 10 a.m. to 3 p.m., and wearing a hat can be really helpful. It is also suggested to reduce the use of computer or television for the first 2 days or use it with a minimum level of brightness. After the treatment, it is very important that you send Dr. Giraldo photos of the treated area every day, especially the first week, to see the evolution. And you can restart with the treatment formulated in consultation a week after the procedure. In summary, the most important aspects are ointment every hour, cold compresses every hour, do not scratch, don't expose yourself to the sun. If you have any questions, please contact Dr. Vanessa Giraldo. And that's all for today's video. We invite you to follow us on our social media, Instagram, Facebook, YouTube, and don't forget to schedule your appointments via WhatsApp. Bye bye.